Namaskar. Welcome to Vision of Asia, a voice of community on ITV Gold. This Sunday, as we meet, we still have the concerns of COVID-19, and second wave of COVID has hit India in a bad way, to the extent that Prime Minister of India referred to it as storm of COVID. In today's Vision of Asia, we have Dr. Sandeep Jain telling us about the precautions that are important during this period. In this week with Padmashri, Dr. Sudhir Parikh, analytical look at COVID-19 situation in India. We also will be remembering Hindi author Padmashri Narendra Kohli ji, whom we lost on 17th April. Georgia Attorney General Charlie Bailey talks about his candidacy. In fact, he is contesting to become Attorney General in Georgia. Shakotsav observed at Vatal, Dham, New Jersey, and glimpses of Haveli Sangeet to mark Phag all the way from Jaipur. All this coming up right after these short messages. Welcome back. You are watching Vision of Asia, was a community on ITV Gold, and as you are aware, we are facing COVID-19 impact, and especially second wave has hit India like a storm, in the words of Prime Minister Narendra Modi. Though India is cautiously moving towards lockdown, other measures are in place yet, as we witnessed increasing death toll in America during first phase. Something in that direction is felt in several cities of India. What we need to do is not to keep our guards down and observe all the protocols. Dr. Sandeep Jain reminds us that even though you are vaccinated, it is important to wear mask and maintain social distance.
My first question to you deals with one of the biggest news that's concerning coronavirus pandemic right now. The pause on Johnson & Johnson's single-dose COVID-19 vaccine. This happened last week due to these rare blood clots seen in women from the ages of 18 to 48. And since then, it's been on a pause. My question to you is, was this pause a wise decision of the government and of the FDA and CDC?
I believe so. I think whenever you have an adverse reaction like that, which is reported in a cluster of people, especially women in this case, and there was one male patient as well, you have to look at the data to make sure that everything's okay. Now, let's put things into perspective. When you take a flight to fly from here to California, your risk of having a blood clot is between 3% to 12%. Wow. The risk of clotting here is only 1 in a million. So it's very minuscule. And I think it's better to err on the side of caution, take a look at the data, and then come up with specific recommendations. And I believe when they do come out with recommendations, they are going to say, let's not give it to people that are at higher risk of clots, who are taking certain kinds of hormonal pills or certain kinds of medicines. And let's wait and see when the recommendations come out. So they would be able to restrict the incidence of even these rare side effects.
Yes, and Dr. Anthony Fauci has said that perhaps we'll know what's going on with the Johnson & Johnson vaccine this Friday. And he's also said that there may be some restrictions. What do you think these restrictions are going to be? And because it is affecting more women right now in the cases that we have seen, do you think it'll be eligible for older women and men instead of that age group that got affected?
Very possibly. Again, I'm sure you're alluding to what happened to AstraZeneca in EU and in Germany and Belgium and all the EU countries. There's a difference between the AstraZeneca vaccine and this vaccine. They're both with adenovirus vectors. However, this is a human adenovirus vector vaccine, and they do work differently. So, can I predict whether they would have a restriction based on the age? There's a good chance that they might do that out of an abundance of caution. Do I believe that the science is there to really restrict it? I don't think so, because the incidence of these side effects has been very, very low.
Right. So are you trying to say perhaps the the benefits sort of outweigh the risk right now, especially looking at the numbers, we're looking 1 in a million?
Yeah, so let's put this again into perspective. We really need vaccines in this country. Whichever vaccine you can get, you should get. The issue here is with Johnson & Johnson vaccine, we have a standing order with the company. We need that vaccine distributed so we can give it to a lot of people and prevent further cases of hospitalizations and death. So the purpose of vaccination was never to get rid of the pandemic completely, which it can't. The purpose is to restrict hospitalizations and restrict the number of people who get really, really sick. To that outcome, I think the vaccine is really important to have. And I believe if you segment it and say, well, we found these kinds of patients are at bigger risk, and let's not give them the vaccine and still continue to give the vaccine, I think it's a fair choice.
Right. These blood clots, Dr. Jain, I'd like to know how dangerous could they get for somebody's body? Could some people be okay even after getting these blood clots, or how risky is that whole thing?
So, unfortunately, these have been very serious kinds of blood clots, either in the brain, a blood vessel in the brain, or in the abdomen. So it has also been found that the incidence of the symptoms have been 7 days to 13 days out from the dose of from the first dose, and people have had headaches as a premonitory symptom, abdominal pain, for example. So I wouldn't categorize them as minor blood clots that people could get by. It caused even one death. I do think that these are pretty serious blood clots, and that's why they had to put a pause on it to come up with a much refined criteria as to who could get the vaccine. And I'm sure we'll see this unfolding in the next few days.
Yes, for sure. And when you are looking at this vaccine, Dr. Jain, the Johnson & Johnson single-dose vaccine, for people that have already been vaccinated, that's about 7 million people in this country already. What's your advice to them? Should they be looking out for any symptoms, even say a week or two after being vaccinated?
So if you've passed the 13-day cutoff that they've found in these handful of cases, or 2 weeks, I think you're okay. The prevalence of these cases has been early on, and it has been a drastic case of blood clotting. So I would think if you've already gotten the vaccine, know a couple of things. One is you can never get another vaccine or drug that is adenovirus based, because you're using the same vector for which your body would now have antibodies. So remember, adenovirus vector is used for cancer treatments. There are a couple of drugs like that. It's used for gene therapy, and it's in the works for other treatments as well. So anyways, it's a one-dose thing. So you've gotten exposed to adenovirus vector. You can't get another product with adenovirus in it. And I think if you've been past the 2 weeks, you're pretty much safe at this point. At least we don't know of any data. Now, if more cases get reported, that's another thing. But so far, we've not heard of any such cases.
Right. Dr. Jain, the Johnson & Johnson vaccine also has a less efficacy than Pfizer and Moderna. And now we're seeing this case of blood clots and the pause in the vaccine. What do we do to sort of encourage the participation of everyone into getting a vaccine? Do you think this is going to increase the vaccine hesitancy in the country?
Of course it will. I think the way it has been blown out in the media and the way it has been discussed, people who are leery of getting vaccines would probably shy away from taking this vaccine.
Right.
However, I think free flow of information as it comes is really, really essential to build trust. So I would say this too shall pass. People who know better will understand that the risk is so minuscule. It's one in a million. It's not that big a risk versus your risk of getting COVID and getting hospitalized or dying from it, especially in certain vulnerable age populations. One other thing I would like to point out, this vaccine, unlike Moderna and unlike Pfizer, has actually been studied in colored people. It was studied in South Africa. So the South Africa strain is better tackled by this vaccine. So it does have an advantage. And we have to wait and see for Pfizer and Moderna when they come up with a booster dose, which will take care of these variants in a better way. But until then, Johnson & Johnson vaccine is a slightly better product for those reasons.
Just a follow-up question to that. What do you say to anti-vaxxers, doctor? We've been hearing that there's actually a huge portion of the community in the United States that doesn't believe in vaccine, and they still think getting a vaccine is somehow more harmful than getting COVID-19. What do you say to those people?
I would say I hear you, and I trust that you're making a judgment based on good information. And if there is an element of mistrust, then you should seek out the answers, talk to your doctors, talk to other people, review the data for yourself. I would also say stay away from social media in researching for your vaccines, simply because there are lots of other countries that would want the US to fail. And there's a lot of misinformation spread on social media, and which unfortunately, this being a free country and freedom of speech being, a prerequisite for us, I think it's just much more smarter for you to actually seek out information with medical professionals, as well as the CDC, as well as other people that are talking about these vaccines. I do think it's a personal choice, and I would respect that. However, I would say consider the odds of a 75-year-old who's not getting the vaccine and gets the disease and the chance of dying from COVID versus the risk of a side effect from the vaccine. Millions of people have taken it. If you would rather be the later ones to take the vaccine, so be it. But it's okay by me. I think I would respect their choices in this case.
In this week with Padmashri Dr. Sudhir Parikh, we take a look at COVID situation in India and how India is preparing to counter and prevent it from escalating. There are many concerns. Dr. Sudhir Parikh analyzed it in objective manner. Namaskar, welcome to This Week with Padmashri Dr. Sudhir Parikh. Dr. Sahab, welcome. Namaste.
Namaskar.
Dr. Sahab, how do you see the rise or sort of a second wave of COVID-19? Do you think it was avoidable, or because of the variant that we are hearing, it was bound to happen?
Well, it was avoidable, but unfortunately, people, because of whatever reason, because of the fatigue, because of the political gathering, because of the religious gathering, and people are not following the strict COVID guideline, I think this wave started, and this wave probably has a variant of the when any infection, in any viral infection, it goes on in the community for a longer time, it mutates. It means it changes, the virus changes its character. And that character, most of the time, is highly infectious. It spreads very fast. And that's what happened in India right now.
And Dr. Sahab, just a few weeks ago, we were looking at India as from the point of view of vaccine mastery, and India also exported vaccine to several nations in the world, extended the helping hand. Now, with this mutant or the variant that you just mentioned, will this vaccine be able to overcome the potential threat by this variant, or we will have to come up with another vaccine? As a physician,
This vaccine is as effective as anything else. And there is this vaccine, but only thing is vaccine has to be given to all the age group, because this variant is very kind of affecting the young populations, and therefore it should be given to everyone in order to break the chain of the this surge. And I'm sure Prime Minister is already announced that everyone above 18 years of age, they will be eligible for the vaccine. And he promised everyone that vaccine will be available in plenty, and there should not be any shortage of the supply.
so in this context, I jump to the latest policy directives that are coming from central government for state governments, and one criticism has come that government is also allowing private professionals or private hospitals to sort of buy and administer vaccine. Do you think the policy that some people get it for free, some people pay it, is likely to result in some sort of a confusion, and should government have taken over the responsibility for vaccinating everyone? How do you look at it?
No, I mean, ideally, government should take the responsibility, just like what they are doing in the USA. But unfortunately, the surge is so powerful. Every day, there are 2 lakhs of new infections are happening. The hospitals are completely full, and whole healthcare system is collapsed right now. And people are kind of. I just now this morning I was talking to someone in the Gujarat, and they are saying that people are having oxygen in the auto rickshaw, or and they have to wait 10 hours to get even cylinder of the oxygen, one who is not breathing right. So that this all kind of very grim situation. So I think vaccine by anyone, whether it's a government or private institute, can afford to give a vaccine, should give, because actually price of vaccine is not that high. It's only 300 rupees for 2 dosage. So I'm sure middle class and upper middle class or even lower middle class can afford that. Only poor people cannot afford it. But I think this is the only way to ramp up the number of vaccination, because once we do the vaccination up to 70-80% of the population, then the whole pandemic will go away.
So, Dr. Shah, earlier there were different theories, and these are unscientific theories, that immune system of Indians, because of the living conditions, is different than what it is here in America, and that potentially was looked at the reason for low number of deaths in India. But looks like that theory is not holding true anymore. We are.
No, because we don't know how the dates are counted or dates are leveled. So, but rather than going into that kind of discussion, right now the problem at hand is very serious, very grim, and very one has to get vaccinated. Most of the population. One has to stop gathering of political, social, or otherwise, and one has to make sure that healthcare system can stand up and survive against this kind of infection. They should create the new hospital, kind of temporary hospitals, and there should be enough oxygen supply, because in this disease, when the infection happens, and those who cannot breathe properly, or whose lungs are affected, those people, if they don't get oxygen, even they get oxygen, they usually end up having a terminal result. It means they die. So right now there is a serious problem, and therefore hopefully the hospitals are there, enough oxygens are there. Government has to make sure that all the auto companies should start making extra ventilators and all those things. But time is too short, and time is only few weeks here, and therefore there is no room for politicking or doing kind of who is right, who is wrong. Just let's work together and attack this problem.
So what you are saying is quite logical, and it makes a lot of sense. And when you look at it from a distance, then it's even more easier probably to see how the whole picture is emerging. But looking at the ground situation in India, exactly opposite to what you said. Politics is again surfacing from opposition as well as from those who are in the ruling situation, whether it is state governments or central governments. And one hears every day, whether it is Delhi government or Bengal, Rajasthan, Maharashtra also, probably with more criticism of center for not providing oxygen and indeed the lack of hospital beds here.
It's not criticism; it is reality.
Right.
Yesterday, I was listening to chief of the AIMS and chief of the COVID task force of the central government. He's saying, and a couple of other doctors were saying, that even a hospital like Just Lok Hospital or Apollo Hospital, they do not have enough beds, they do not have enough ventilator, and they do not have enough oxygen supply. And so that is not criticism by anybody to anyone, but it is reality. And we have to forget about the politics. We have to forget about who is right and wrong, as I say. And government has to make sure that all the industrial oxygen should be diverted for a healthcare system to take care of patient, because health is the first and manufacturing is second.
Very good point. And in the same way, there are reports that the number of people gathering to observe Ramadan, that also is being addressed, and many leaders at the Kumbh Mela have agreed to Prime Minister's call. He also talked personally to some of them, and so we hope good sense prevail, and what needs to be done is done. Being NRI and looking at this situation from USA, being active with many organizations, including RP, etc., do you see any role at this point of the physicians who are from Indian origin and away from India, if they can do something?
Well, they can only talk to their relatives and friends and make sure and convince them to go ahead and get the vaccine done. Do not hesitate to get the vaccine, because we have so many rumors and so many wrong social media posting that vaccine has problem, vaccine is not good, blah blah blah, and then we being sometime some people are very superstitious too. So all those things we can explain. Other than that, doctors or anybody from here, not much can help really, other than supplying more vaccination. Let other vaccine like Moderna and Pfizer can go to the India, and Indian government should ramp up the whole thing and get vaccinated. And you convince everyone wherever you get a chance that vaccine is safe, it is must, and one must get it.
Absolutely. And as we move towards the concluding part of our conversation, I bring to your attention again Prime Minister Narendra Modi's statement that second wave of COVID has hit like a storm. Also, somewhere is an admission that they could not foresee that it could escalate to this extent. And I think the system is not prepared, and neither it was here in America. So that needs to be done on war footing, which I hope is being taken sincerely. And as we conclude, your take on the suggestion by Bengal Chief Minister that the rest of the three-phase polling in Bengal should be combined, and maybe it can be done away in one way or something. Do you see that as a practical approach, and whatever way Election Commission responds to it?
I think because of the COVID and because of the all the party, including BJP and TMC, they all decided to not to hold a rally more than 500 people anymore going forward for last 10 days. So I think it's not bad idea to have all the poll clubbed together. That way there is a less exposure or less crowding, less get together, and that may help, because in even Bengal also the cases are rising. Yesterday it was almost 8,000 new cases per day, and that is not good sign. And therefore, and we may hear even worse than that, because usually it takes 2 weeks after all this gathering happens. So I think it's not a bad idea to club together last three phase and get the election done even sooner than later.
Absolutely. And I think Election Commission would consider the practical side of making it happen, and hopefully things will move in the right direction. And your parting words for our viewers from this edition, Dr. Parikh.
Yes, what I would like to tell my all Indian American friends to call their relatives, friends back home, explain to them what is important guidelines for COVID, tell them to follow that, do not take it lightly, and most important that please get vaccinated. If you can afford to pay 300 rupees, go and get vaccinated privately. But sooner you vaccinated, better you will be. So please do that, and hope everything works out well. And we pray God that India, this COVID situation in India should curtail sooner than later. And thank you very much. Thank you for joining me this week. We'll see you next week. Till then, goodbye. God bless America. God bless India. God bless Indian American community. And thank you very much.
Vyas Sammanit and Padmashri honored Narendra Kohli ji is very, very well-known name for all Hindi literature lovers. Rooted in Indian culture, he gave wonderful series of novels based on the story of Ramayana, which was termed as Abhyuday. Mahasamar was based on Mahabharata. He also wrote an important book based on the life of Swami Vivekananda, Toro Kara Toro. Narendra Kohli ji was born in Sialkot, Pakistan, 6 January 1940. Due to COVID, on April 17th, 2021, we lost him. Remembering him with poet Abhinav Shukla. Here are some excerpts from that conversation dedicated to Narendra Kohli. और स्वागत करने के साथ हम याद कर रहे हैं उन चुनौतीपूर्ण क्षणों को जो हमारे अपनों को हमारे बीच से छीन कर ले जाते हैं। कोविड-19 एक कारण बन गया है इस महामारी के चलते एक नई लहर चुनौती की भारत में कहर बरपा कर रही है। 17 अप्रैल 2021 हिंदी प्रेमियों ने अपने चहीते लेखक जिनके नाम से एक पूरा हिंदी भाषा का युग जाना जाने लगा है, ऐसे पद्मश्री से सम्मानित, व्यास सम्मान से सम्मानित, अभ्युदय, महासमर, तोरो काड़ा तोरो जैसी कृतियों के लेखक नरेंद्र कोहली अब हमारे बीच नहीं रहे। जनवरी 1940 से उनकी यात्रा सियालकोट पाकिस्तान में जो प्रारंभ हुई थी, उसका अवसान 17 अप्रैल 2021 को हो गया। उनकी स्मृतियों, उनके प्रति श्रद्धांजलि के लिए हमारे साथ जुड़े कवि अभिनव शुक्ल। उनके साथ श्रद्धांजलि के इस क्रम में प्रवेश करते हुए स्मरण नरेंद्र कोहली का। मैं अशोक व्यास और स्मृतियों के गलियारे से होते हुए जब श्रद्धा के साथ हम एक ऐसे व्यक्तित्व को याद करते हैं जिन्होंने संस्कारों के प्रवाह को रसमय ढंग से अपनी लेखनी के द्वारा इस तरह हिंदी के पाठकों तक विशेष करके पहुंचाया कि वो न केवल संस्कारों की धरोहर पहुंचाने में एक अग्रणी लेखक के रूप में अपनी पहचान बना गए, साथ ही साथ सबसे अधिक बिकने वाली हिंदी की पुस्तकें लिखने वाले लेखक के रूप में भी नरेंद्र कोहली जी का नाम रहा है। उनका जन्म 6 जनवरी 1940 को सियालकोट पाकिस्तान में हुआ और कोविड के कारण पिछले 17 अप्रैल 2021 को वो हमारे बीच से विदा हो गए।
सत्यवती ने कुछ नहीं कहा। उसका मन रोने रोने को हो रहा था। तपस्वी के मुख की ओर देखने का उसका साहस नहीं हो रहा था। वह जानता था, वह जानती थी कि यदि अब भी तपस्वी उसे थाम लेता और कहता सत्यवती तुम मेरी हो, तो शायद सत्यवती घर भी न लौट पाती। किंतु उसका विवेक उसे लगातार चौकस कर रहा था। सत्यवती उठ, चल, इससे पहले कि तपस्वी फूट पड़े तू चल पड़, नहीं तो बहुत देर हो जाएगी।
पर नरेंद्र कोहली जी जैसे व्यक्तित्व हमारे भीतर जिस तरह रचे बसे होते हैं, ऐसा लगता है वो और अधिक जीवित और अधिक मुखरित हो उठे हैं, ऐसा कई लोगों को लगने लगा है। और ऐसे ही उनकी आत्मीयता और उनकी लेखनी के प्रभाव से समृद्ध अपने आप में एक ख्याति नाम कवि अभिनव शुक्ल जी मेरे साथ जुड़ रहे हैं। हम दोनों मिलकर उस महामना को याद करें तो अभिनव जी, आप तक मैं ये बात लेके आना चाहता हूँ कि लेखन और पठन, तो जो पाठक का एक लेखक से संबंध बनता है उसकी अपनी एक पवित्रता होती है। विशेष करके अगर रामचरितमानस के चरित्रों पर आधारित श्रृंखला लिखने वाले नरेंद्र कोहली जी की बात हम कर रहे हैं, तो आप, मुझे पता है कि कैसा लगता है उनका जाना, पर अभी ये मानते हुए कि वो यहीं हैं, आप अगर वहाँ चलें जहाँ आपने पहली बार नरेंद्र कोहली जी को पढ़ने का अवसर पाया होगा, कौन सी पुस्तक थी, कुछ याद आता है?
मैंने पहली पुस्तक जो नरेंद्र कोहली जी की पढ़ी थी उसका नाम था अभ्युदय। अभ्युदय राम कथा पर एक पुस्तक थी, और जब मुझे पता चला कि जो पुस्तक मेरे पास है वो राम कथा पर है, और मैं, क्योंकि तुलसीदास की रामचरितमानस मेरी प्रिय कविता की पुस्तक है, तो मेरे मन में कोई बहुत आकर्षण उस पुस्तक को लेकर नहीं था, या बहुत एक्साइटमेंट शुरू में नहीं था। शाम के करीब 6-7 बजे वो पुस्तक मैंने पढ़ना शुरू करी, और पृष्ठ दर पृष्ठ कब सुबह के 5 बज गए, और वो मोटा ग्रंथ है, और वो पूरी पुस्तक, मैं रात भर सो नहीं पाया उस पुस्तक को पढ़ते समय। हर पृष्ठ के बाद जैसे राम कथा को पुनर्जीवित करना, एक पूरे नए दृष्टिकोण से राम कथा को लिखना। राम जहां पर भगवान नहीं है, राम आपके और हमारे जैसे एक सामान्य व्यक्ति हैं, एक राजा के पुत्र हैं, और हम लोगों के जीवन में जैसी घटनाएं घटती हैं उस प्रकार की घटनाओं से गुजरते हुए उनके चरित्र का निर्माण कैसे हुआ, वो तेवर, वो भाषा, वो सरल नरेंद्र कोहली जी ने अपनी उस पुस्तक में लिखी थी। और उस पुस्तक ने मेरी एक रात जो है उसको जगमग किया, और उसके बाद तो मैं नरेंद्र कोहली जी का बहुत ही मन से नरेंद्र कोहली जी को पढ़ने वाला पाठक बन गया। अभी नरेंद्र कोहली जी का जब निधन हुआ तो मैंने कुछ पंक्तियां उनको श्रद्धांजलि देते हुए लिखी हैं। मैं वो पंक्तियां सुनाकर फिर आपके पास वापस आता हूँ। अशोक जी,
स्वागत है।
कि नवयुग का तुलसी बन जिसने श्री राम को नव जयगान दिया। जितने भी श्रोता ये श्रद्धांजलि का कार्यक्रम देख रहे हैं, मैं चाहूंगा कि वो अभ्युदय अवश्य पढ़ें, वो अभिज्ञान अवश्य पढ़ें। अगर उन्हें लगता है कि अभ्युदय बहुत मोटी है, अभिज्ञान तो बहुत छोटी सी पुस्तक उन्होंने सुदामा और कृष्ण के संबंध पर लिखी है। नवयुग का तुलसी बन जिसने श्री राम को नव जयगान दिया, प्रतिभा, श्रम, त्याग, समर्पण से भाषा का ऊंचा भाल किया, जीवन के महासमर में जिसने चक्रव्यूह सब भेद दिए। महाभारत पर उन्होंने 9 खंडों में महासमर नाम की श्रृंखला लिखी है। जीवन के महासमर में जिसने चक्रव्यूह सब भेद दिए, युग युग की काराएं तोड़ी, मोती बिखराए वेद दिए। जिसकी ऊंचाई के आगे हिमगिरी पौना हो जाता है, जिसकी परछाई छूने को अंबर भी हाथ बढ़ाता है, उस कलम के पावन शब्दों को मैं नित नित शीश नवाता हूं। ऐसे नरेंद्र कोहली जी को मैं श्रद्धा सुमन चढ़ाता हूँ। ऐसे नरेंद्र कोहली जी को मैं श्रद्धा सुमन चढ़ाता हूँ। और
बहुत सुंदर अभिव्यक्ति आपकी जी जी। जो सभी के
माता ने उन्हें अपने पास बुलाया है रामनवमी से 4 दिन पहले, जैसे वो श्री राम की जन्म की बधाई गाने के लिए ईश्वर के पास चले गए हैं, उन्हीं की शरण में चले गए हैं, ऐसा लगता है। मेरा हृदय बहुत दुखी है उनके जाने से, पर मेरे मन में इस बात की बड़ी एक जिम्मेदारी का एहसास भी है कि उन्होंने जो हमें मार्ग दिखाया है, एक समाज के रूप में, एक लेखक के रूप में, कवि के रूप में, हमें उस मार्ग पर आगे बढ़ना है।
मेरे साथ आओ, इस कमल वन में विहार करो और तुम पद्म गंधा हो जाओगी। सत्यवती जैसे तपस्वी द्वारा मोहित हो गई थी, उसने अपने बाँह छुड़ाने का प्रयत्न नहीं किया, पर उसके विवेक जैसे हाथ में कशा लेकर लगातार उसे पीट रहा था। यह ठीक नहीं है सत्यवती, यह ठीक नहीं है, संभल जा। तू जानती भी है तेरे माता पिता क्या कहेंगे, तेरा समाज क्या कहेगा। तेरा यह शरीर तेरा अपना नहीं है, इस पर तेरे समाज का अधिकार है। उससे पूछे बिना न तू इससे सुख उठा सकती है, न किसी को सुख दे सकती है। पर शरीर था कि विवेक की बात पर कान नहीं धर रहा था।
फिर एक बार मैं आपके साथ जहाँ सम्मान के साथ स्मरण कर रहा हूँ, आदरणीय पद्मश्री व्यास सम्मान प्राप्त और हम सबको समृद्ध करने वाले नरेंद्र कोहली जी का मैं साथ ही साथ उनके पूरे परिवार और शक्ति की प्रार्थना उनके लिए करते हुए विशेष आदर के साथ और स्नेह के साथ में मधुरिमा जी आदरणीय उनका भी स्मरण कर रहा हूँ। और चलते चलते सिर्फ 1 मिनट में आप कार्यक्रम रिकॉर्ड होने से पहले आपके मन में परिकल्पना है कि उनकी धरोहर को संरक्षित रखने के लिए अमुक भी प्रकल्प हैं जो उठाए जाने चाहिए, उसका संकेत आप हमारे दर्शकों तक पहुंचाएं।
देखिए, हम लोग नरेंद्र कोहली जी के लिए अनेक स्थानों पर श्रद्धांजलि सभाओं का आयोजन हो रहा है, पर नरेंद्र कोहली जी का जो व्यक्तित्व है वो एक श्रद्धांजलि सभा तक सीमित नहीं हो सकता है। हमें नरेंद्र कोहली जी के पाठक होने के नाते उनके प्रति सद्भाव और उनकी धरोहर को संजोने के रूप में जब मैं देखता हूं तो मुझे लगता है कि हमें कोई या तो सरकार की ओर से कोई एक ऐसा पुरस्कार नरेंद्र कोहली जी के नाम पर शुरू हो जो उनकी धारा में जो लोग लेखन करते हैं उनको प्रदान किया जाए। एक कोई विश्वविद्यालय का नाम आदरणीय नरेंद्र कोहली जी के नाम पर हो, जिस विश्वविद्यालय में वो जो चेतना है, वो जो समाज को संगठित करने की चेतना है, वो जो हमें अपनी धरोहर को संजोने की और भविष्य की ओर पूरी स्वाभिमान के साथ आगे बढ़ने की जो चेतना है, उसके लिए बच्चों को तैयार किया जाए, तो मुझे लगता है कि ये धरोहर हम उनकी आगे तक हम ले जा पाए।
Charlie Bailey is contesting to become Attorney General of Georgia, and what is it that he is putting on the table for voters to decide in his favor? He talked to Aditi Lamba for ITV Gold.
A big moment happened yesterday in terms of police reform, in terms of getting a word on systemic racism, in terms of seeing if justice was going to be delivered, and that was the trial of Chauvin. Former police officer Chauvin has been charged with all 3 charges that he was convicted with. My question to you is, how are you looking at this? And as a possible, potential Attorney General, how are you understanding this entire situation? What kind of message does it send?
Well, I'll say that I think, like a lot of Americans yesterday, maybe exhaled, felt a sense of relief when our fellow citizens in that jury in Minneapolis returned a verdict holding Officer Chauvin accountable for his actions. And we have a lot of policies we need to change, laws that we need to change, and hearts that we need to change. But it was a small, but I think significant step towards recognizing, kind of these basic values of human commonality, that if any of us are going to matter, then George Floyd's got to matter. If the American dream is going to matter, if the ideals that we say, equal protection under the law, that everybody deserves the same manner of justice, if any of those words are going to matter, then it had to matter what happened to George Floyd. And I've been thinking about his family and the strength that they have shown throughout this. And I just pray that yesterday brings them. You can't bring George Floyd back. There's nothing that'll ever make it okay. But I hope that verdict gives his family at least some measure of peace about the tragedy that's happened in their life, and the rest of us got a lot of work to do to make sure we don't have any more George Floyds, and that we make some of the systemic changes that we need to make in our criminal justice system.
And exactly what I was going to ask you as my next question. The criminal justice system is quite broken when it deals with the Black and brown communities. As an Attorney General, you will be dealing directly with the criminal justice system. What kind of changes do you want to make?
Well, one of the big things that I'm talking about, and of course I was the Democratic nominee last time in 2018 and got 49% of the vote while on the ticket with Stacey Abrams, my friend Stacey Abrams. And in that campaign, I talked about this, and I'm speaking about it again, and that is that, in Georgia, we don't have a civil rights division in our Attorney General's office. When I'm elected Attorney General, I'm going to build a civil rights division in that office. And, to be the cradle of the civil rights movement in the Empire State of the South and to not have a civil rights division means you don't prioritize civil rights, to me, is a dereliction of duty. And with that civil rights division, I'm going to advocate for the passage of a state civil rights bill, which we do not have, that'll give my division the tools it needs to go after employment discrimination, to go after discrimination in housing, discrimination in lending, to do pattern and practice investigations of rogue police agencies or rogue elements within those police agencies. So I think that is, the other part of this is you got to be, I think, you're the top prosecutor in the state. You're the top law enforcement official in the state. You have to be outspoken, and I will be outspoken about the need for criminal justice reform. You have a platform to use, and you ought to use it. My opponent never speaks about these issues. So there's direct action you can take, and then there's leadership that you can exhibit. The reason I have the endorsement of, some of these new DAs that flipped seats, Republican to Democratic in Georgia, whether that be Fonnie Willis and Fulton, who didn't flip the seat, but she beat an incumbent in a primary. Flynn Brody, who's the new Cobb DA, Dolly Racine, the new DA in Douglas County. These are all metro Atlanta counties. One of the reasons of that is they know through my time as a prosecutor, I've actually not just read about criminal justice reform, but in the practice, put it into practice and made some of those decisions. And so I will be a leader on those efforts, whether we're talking about that civil rights division, whether we're talking about issues around restorative justice. It's far past time that the top prosecutor in our state be clear where we stand, and that is where I stand on the part of every person in the state ought to be able to expect that they can get that same manner of justice and that their kids will be safe, when they walk down the street. And that covers all manner of reforms we need to make within policing as well.
Welcome back. You are watching Vision of Asia, Voice of the Community on ITV Gold, and this program this Sunday at 11 a.m. But we have Monday, Tuesday, Wednesdays and Thursdays editions of Vision of Asia at 8 p.m. on ITV Gold. We appreciate your continued support and appreciation for our efforts to connect community. Stay with us. We'll be right back after these short messages. Vatal Dham has been active in observing all the Hindu festivals. Devotees gathered and observed Shakotsav recently at Vatal Dham, New Jersey. Here are some highlights from that event.
કાનમ સરોતરથી કચ્છથી પણ હરિભક્તો બધા આ ઉત્સવનો લાભ લેવા આવ્યા અને દિવ્ય ઉત્સવનો તૈયારી વાતાવરણ જામ્યું. મહારાજ પોતે આ ઉત્સવની બધી તૈયારી કરાવી. રીંગણા ને સંતો સરસ ધોઈને સુધારી અને મહારાજને પાત્રમાં ભરી ભરીને આપે.
Jai Swaminarayan, Vatal Dham, Shri Swaminarayan Mandir. Today there was a Shakotsav, Bhagavan Swaminarayan, and according to his system, we did the Shakotsav. Swamiji was here, and almost all Haribhaktas following the coronavirus tradition with a mask, and Shakotsav is done very well. So we celebrate in Shakotsav today. Jai Swaminarayan.
જય સ્વામિનારાયણ. વડતાલ સમરસેટ સ્વામિનારાયણ મંદિર, લક્ષ્મીનારાયણ દેવની ગાદીનું આ મંદિર છે. અહીંયા અમે જેમ લોયામાં શાકોત્સવ હરિકૃષ્ણ મહારાજે કર્યો હતો અને જેમ શાંતાબાને ઈચ્છા થઈ હતી અને સુરા ખાચરે શાકોત્સવ કર્યો એ રીતે અમે પણ આ મંદિરમાં શાકોત્સવ કરીએ છીએ અને બધા હરિભક્તોને ભેગા થઈ બહેનો પણ મળી અને શાંતાબાને યાદ કરતાં કરતાં, દાદા ખાચરને યાદ કરતાં કરતાં અને સુરા ખાચરને બધાને હરિભક્તોને યાદ કરતાં કરતાં શાક સમારીએ, શાક વઘારીએ અને બધા હરિભક્તો અહીંયા આવી અને મહાપ્રસાદ લે છે. તો ભગવાન બધા પર રાજી રહે અને કોરોનાનો જે કાળ આવ્યો છે એમાંથી બધા મુક્ત થાય એવી હરિકૃષ્ણ મહારાજને, લક્ષ્મીનારાયણ દેવને અમારી પ્રાર્થના. દાદા હનુમાન દાદા સારંગપુરવાળાને પણ અમારી પ્રાર્થના. ગોપીનાથજી મહારાજ, રાધારમણ દેવ સર્વે હરિભક્તોને સુખિયા રાખે એવી અમારી પ્રાર્થના છે. જય સ્વામિનારાયણ.
જય સ્વામિનારાયણ. આ વડતાલ ગાદીનું અમેરિકા ખાતે વડતાલ ધામ ન્યૂજર્સી સમરસેટ મંદિર છે. અહીંયા આપણે દરેક તહેવારો ઉજવીએ છીએ. આ તહેવાર જે છે આ ઉત્સવ સ્વામિનારાયણ સંપ્રદાયનો સ્પેશિયલ ઉત્સવ છે, શાકોત્સવ. આજે 700 પાઉન્ડનું રીંગણાનું શાક અહીંયા બનાવવામાં આવ્યું છે અને સ્વામિનારાયણ ભગવાને એ વખતમાં 60 મણ રીંગણા અને 12 મણ ઘીના વઘારમાં શાક બનાવ્યું હતું લોયા કાઠિયાવાડમાં. તે વખતથી સંપ્રદાયમાં શાકોત્સવ થાય છે અને આવા દિવ્ય શાકોત્સવ દરેક મંદિરમાં ઉજવાય છે. આ મંદિરમાં વર્ષમાં આપણે 2 વિન્ટરમાં શાકોત્સવ કરીએ છીએ અને અહીંયા હજારો માણસો શાકોત્સવનો પ્રસાદ લે છે. અહીંનું શાક અદ્ભુત અને દિવ્ય હોય છે અને બધાને ખૂબ જ ગમે છે. એટલા માટે દૂર દૂરથી ભક્તો અહીંયા શાકોત્સવનો પ્રસાદ લેવા આવે છે. તો આવા ઉત્સવ દ્વારા જીવો ભગવાનમાં જોડાય, એમનું કલ્યાણ થાય, એમનું હિત થાય એ હેતુથી ઉત્સવ ઉજવવામાં આવે છે. અત્યારે કોરોનાના વાતાવરણમાં સોશિયલ ડિસ્ટન્સ રાખીને દરેક લોકોએ માસ્ક પહેરીને અને નિયમો જાળવીને જ્યારે ઉત્સવ કર્યો છે ત્યારે ભગવાનને પ્રાર્થના કરીએ કે આ કોરોના કાળમાં ભગવાન શ્રી હરિ સર્વનું રક્ષણ કરે અને સર્વની જે આવેલી ઉપાધિઓ દૂર થાય અને વહેલો આ કોરોના કાળમાંથી બધાને મુક્તિ મળે અને સર્વને શાંતિનો, સુખનો અનુભવ થાય એવી ભગવાનના શરણોમાં પ્રાર્થના કરીએ. આ ટીવી ગોલ્ડના દર્શકોનો અને કાર્યકર્તાઓનો ખૂબ ખૂબ આભાર અને ખૂબ આવી રીતે આપણે ભારતીય સંસ્કૃતિના પ્રસંગો ઉજવી અને ભારતની સંસ્કૃતિની મહાનતાની ઘેરે ઘોર આપણે એની ગૌરવ ગાથાને પહોંચાડીએ એવી અભ્યર્થના સાથે જય સ્વામિનારાયણ.
જય સ્વામિનારાયણ. સમરસેટ ન્યૂજર્સી સ્વામિનારાયણ મંદિર. આજે અમારે અહીંયા રીંગણના શાકનો ઉત્સવ બહુ જ સરસ, ખૂબ મજા આવી એવો બન્યો અને 700 પાઉન્ડ શાક બનાવ્યું. જે સૌરાષ્ટ્રમાં ભગવાને શાકોત્સવ કર્યો તો નર્યા ઘીમાં શાક બનાવી એવું જ શાક અહીંયા આગળ બનાવી હરિભગતોને ખૂબ આનંદ આપ્યો અને હરિભગતે ખૂબ આનંદથી પ્રસાદ લીધો અને ધામધૂમથી એ પ્રસંગ દર વર્ષમાં 2 વખત અમે આ સમયો કરીએ છીએ અને એમાં ખૂબ મજા આવે છે અને મહારાજની એટલી યાદ આવે છે લીલાઓ કે ભૂલી ના શકીએ. એટલી સરસ લીલાઓ યાદ આવે છે કે અંતકાળે પણ યાદ રહેશે એવો મજાનો આ ઉત્સવ થાય છે. જય સ્વામિનારાયણ.
Haveli Sangeet is an important way of praising the Lord, and that traditional path of worshipping Lord Krishna as is enunciated by Vallabhacharya ji is known as Pushtimargeeya devotional singing is termed as Haveli Sangeet. During Phag, there are some special devotional songs which are sung to please the Lord. We have some excerpts from Phagotsava with Haveli Sangeet and a little bit of explanation by Govind Malpani ji from Jaipur. Take a look.
जीवन में हित कब नहीं होगा? जब आपके विचार कंस्ट्रक्टिव रहेंगे, पॉजिटिव रहेंगे, और जैसे समुद्र में लहरें कई दफा उल्टे सीधे तूफान आते हैं पर किनारे पर शांत हो जाती है। इसलिए जीवन में आपके कई अमंगल प्रश्न बनेंगे, कई आपकी इच्छा के अनुरूप नहीं बनेंगे, लेकिन फिर भी कभी भी धैर्य मत खोइए। डोंट लूज योर पेशेंस, नेवर। यदि आपने अपनी धैर्य शक्ति को कायम रखा है तो आपके ठंडे दिमाग से वही चीजें निकले के आएगी जो भगवत स्मरण से आती है। आपने अजामिल का एक प्रश्न भागवत में आता है यहाँ, या स्वामी रामसुख दास जी एक अपने यहाँ बड़े संत हुए हैं जो अभी ऋषिकेश में विराजते थे और अभी जिनका 8-10 साल पहले ही गोलोक में पास हुआ है, वो एक बात हमेशा कहा करते थे, मेरे पास सुबह 4:30 बजे लोग क्यों मेरा प्रवचन सुनने आते हैं? मैं भी माँ के पेट से उसी तरह से आया हूँ, पर मेरे पास एक धन है, वो है भगवत नाम का। इस नाम के धन के, और ये मैं लेता भी हूँ और करवाता भी हूँ, तो जो करते हैं और जो करवाते हैं उनमें भगवत स्वरूप और भगवान स्वयं आके विराजते हैं। और यदि भगवान आपके हृदय में विराज रहे हैं, या पॉजिटिव एटीट्यूड जिसको मैं दूसरे समय कहूँगा, ये आपके हृदय में विराज रहा है, तो फिर आपको कभी भी गलत कार्य करेंगे नहीं और अच्छे की ओर दृष्टि कर जाएंगे, और आपकी भी उतनी प्रशंसा प्रसिद्धि होगी जितनी एक बहुत अच्छे प्रसिद्ध व्यक्ति की होती है।
And now time to say goodbye from today's Vision of Asia Voice of Community. But once again, we would like to remind you, you can always be with us through our programs on our Facebook page. Be friends of ITV Gold's Facebook page, as well as subscribe to our YouTube channel, and keep writing events@itvgold.com. Stay safe, stay well. Thanks for joining. Lots of good wishes. This is Ashok Vyas. Namaste.